Well, my healthcare needs, like for diabetes and a few other things like degenerative disc in my back, and arthritis.
Another one was housing, so maintaining and sustaining his housing. So we tried to involve all care providers that were involved in those areas of his life so that everyone could help him in those goals.
So when I first started Shikok-McCoy, he was one of the first clients that I had worked with. And then so kind of seeing over the years him accessing the nurse practitioner program and the chiropodist, and then also too, as my schedule got busy and we had other sites, he was also connected with other social workers.
And so to be able to have everyone come together and be able to be on the same page, and not only just the same page, but that individual's same page, because it's so important that their care is about them and comes from them.
So some of the people that were involved in his care were his nurse practitioner, his psychiatrist, the nurse from Diabetes Care Services, the pharmacist from Diabetes Care Services, the office administrator from the building that he lived in, social assistants, a peer support worker.
Once the plan is in place, and everyone is contributing to it and updating it on a regular fashion, on a regular basis, we're really able to better provide for our patients. And ultimately, we're all in this for the same end goal. We all want to provide excellent care.
Here at Shikok-McCoy Health Center, we use a model called the woven blanket. And what that is knowing that each of our practitioners have a voice in helping this client, if needed. So if someone comes in and sees a nurse practitioner and that nurse practitioner feels that they would be better supported or need additional support with mental health care, they'll make an internal referral over to our mental health team. If they feel that the client could benefit from seeking more traditional practices, a referral will be made to that program.
With the struggles to try and reach goals and try and accomplish all the things that Bruce wanted to, there was also the struggle of identifying with mental health challenges and how that can be frustrating sometimes when you're trying to reach for something, or how that can create setbacks that you didn't expect.
Wellness is more than just having a prescription. It's also feeling part of something, knowing what your role and purpose is, and also just feeling comfortable in your own space.
I guess it coordinated everything together.
That's right.
It seemed to, I thought it made a big difference.
For me, I was able to connect people to the proper services and see how effective working as a team from different service backgrounds and coming together and how that helps people. So I would say it's something that I encourage everyone to do.
I hope that it shows them how much they're capable of.
You see the eye contact he makes with people, and that sharing a joke in the hallway, or just that familiarity. So even out in the community, you know, when I see Bruce out in the community, it's like, hey, how's it going? He recognizes me and I recognize him because we are part of something together.
I told you about how I felt like a teenager, getting better. I found it helped quite a bit. The right hand's knowing what the left hand's doing.